the first edition of ADHD Unhinged. Are you the parent of a teen that has diagnosed or undiagnosed ADHD? And sometimes you feel like you're walking on eggshells whenever you're around them. Well, you're not alone. My name is Dr. Christine Powell. I'm an education therapist and licensed special educator, and I work with individuals with ADHD and the ones that love them. And today we're going to talk about some neuroaffirming research-based strategies, as well as covering 4 areas that are commonly associated with tripwires for teens with ADHD. Now, this information was specifically taken by the Chief of Child and Adolescent Psychiatry at Massachusetts General Hospital, Dr. Willens himself, who covers these 4 areas that he sees in his practice about the challenges that teens have. So let's cover all 4 right now, and then we'll break it down a little bit more into specific recommendations. So number 1 is managing increased academic demands in teens with ADHD is challenging. Number 2, kind of reducing their social phobias and isolation. Number 3, preventing substance use. And number 4, encouraging self-reflection and self-monitoring. Now, before we get into those areas of challenge, let's first cover brain development. In teens, especially teens that have ADHD, we see neurotypical growth in the prefrontal cortex or the frontal lobe of their brain. So during the ages of probably 14 to 26, there's a rapid growth in the prefrontal cortex. And with individuals that have ADHD, we see that they're approximately 2 years behind, oftentimes in the development of skills, specifically executive functioning skills. Those are the skills associated with organization, planning, time management, even impulse control. Also, we see a lag in the limbic system of teens with ADHD. That's the area of the brain that's associated with emotion, anxiety, a reward system, as well as taking risky behaviors. So this differential in the development of their brain, teens with ADHD, really puts out the importance for parents and care providers to understand the challenges and hopefully be able to have strategies within their toolbox to help their teen as well as themselves. So let's jump into the first area of the challenge. That would be managing increased academic demands. So as we know, when students move from middle school up into high school, there's going to be an increased demand in their workload. Now, oftentimes that workload is associated with homework, more rigorous academic classes, as well as tests. And not just tests, we have high stakes tests often when we move up through high school that play a significant role on the trajectory to post-secondary education or trades. What's that going to look like? And there's been an increasing complex and competitive college and trade application. So understanding kind of how that works can be very anxiety provoking for kids. That's an extra demand on top of everyday homework and assignments. We know that when teens miss school because of absences, whether they're sick or they've developed psychosomatic illnesses, saying that if they don't feel well because they have heightened anxiety because of school, missed days lead to missed assignments, which can impact their confidence as well as their GPA. You probably won't be surprised, parents, to know that if your child has ADHD, they're at an increased risk of dropping out of high school. Now, studies show that because of school avoidance and school failure, that dropping out may seem like the only plausible kind of next step for students that's really having a challenge within school. But the negative repercussions for dropping out of school will affect your child for a lifetime, to include future income levels, higher ability, confidence, and really just life trajectory. Having a diploma from high school is imperative to move forward in a productive way. And I would really encourage parents to create communication within the school to really support and help your child work through that and graduate. There are ways for that to happen. Number 2 would be reducing social isolation. Again, studies show that a child that has a diagnosis of ADHD is reportedly stating that they are at more isolated and at risk of becoming lonely or suffering social isolation, put it upon themselves. They've reported in studies that subjective studies that students with ADHD have been polled, that they feel more isolated than their peers, they have smaller social circles, and they're lacking oftentimes someone that they can go to for support or help because they feel alienated or not part of the bigger community. Now, I would call to parents to help in this way by really trying to help their child put away social media, get them out of their room, increasing their social circles by engaging them just in family time, but also possibly in larger social contexts of, religious affiliation groups or book clubs, or pursuing areas of interest that take them out of that very myopic, focused view of themselves. Students or children with ADHD, teens with ADHD, oftentimes are not a reliable source when you ask them, how are you doing? And they report back, I'm good. They don't have the ability to self-express that maybe a student that was older or more, cognitively aware would be able to understand that they may be depressed or, not feeling that they, are willing to accept help, but help is needed. Number 3, an area of challenge that is common among teens with ADHD would be preventing substance use. Alcohol impairs memory and cognitive function, and we know that early use of marijuana decreases our brain's capacity for uptake of information and our ability to learn and really focus. So preventing substance use among teens that have ADHD is imperative. And contrary to what I initially thought before my son went on medication, and through my own kind of research into medication and students on medication, that studies show that early stimulant medication for teens with ADHD actually has a lower risk of substance use disorders in their future. And when parents come to see me because their children are having challenges in school, possibly they don't want to put their child on medication, and I see that as a, legit, first passage of, seek, cognitive mental health first. However, in many cases, when a child is really impacted by the symptoms of ADHD, getting a doctor to prescribe a stimulant, if that's one that's warranted, in order to increase focus and on-task behaviors and their ability to critically think and problem solve, is oftentimes a good course of action. Now, knowing the research that in fact that doesn't lead to substance abuse challenges in the future, they're not at greater risk. The 4th area would be encouraging self-management. Oftentimes when a teen has ADHD, they participate in a lot of negative self-talk, they have low confidence. Again, that may be impacted by lower grades and their inability to have executive function to work with so many moving parts at once. A recommendation would be to seek help and support, whether it's through CPT, like cognitive behavioral therapy, or an executive functioning coach, or somebody that's on the outside that's able to present a larger perspective and put together all those pieces for your teen to help them, again, stand back, self-monitor, organize and plan, and move forward in a productive way. So long-term studies confirm that if unaddressed, these 4 challenges can learn to adversely affect the quality of your child's life over the long term and their general functioning into adulthood. So if you have any questions or comments about what I've said, please put it in the comments. And if there's any other specific areas that you'd like addressed, or me to dig into the research and find strategies or tools for you to work with as a parent or as an individual, please Let me know and make yourself known. I'm at learningbyconnecting.com. Again, I'm Dr. Christine Powell, an education therapist, and I'd love to hear your comments or suggestions.